Why is TST induration measured, not erythema? Imagine getting a skin test for tuberculosis and wondering why doctors focus on the swelling rather than just the redness. The reason lies in how our immune system reacts to the test. When a person has been exposed to tuberculosis bacteria, their immune system remembers it. The Tuberculin skin test, or TST, is designed to detect this memory by injecting a small amount of purified protein derivative into the skin. After 48 to 72 hours, healthcare providers examine the site to see how the skin responds. The key measurement is the induration, which is a firm, raised, hardened swelling at the injection site. This induration indicates a cellular immune response involving T lymphocytes and macrophages. These immune cells gather at the site if the person has been previously sensitized to tuberculosis bacteria. The size of this swelling is measured in millimeters to determine if the reaction is significant enough to suggest infection. On the other hand, erythema is just redness caused by increased blood flow to the superficial layers of the skin. While redness can be visible and sometimes noticeable, it is a nonspecific response. Erythema can occur due to skin irritation, injection technique, or other causes unrelated to tuberculosis. Because it is not directly linked to the immune response against the bacteria, erythema alone is not a reliable indicator of infection. Measuring induration provides a more consistent and objective way to interpret the test. Trained healthcare workers can palpate the skin and measure the diameter of the hardened area accurately. This measurement is then compared to established guidelines, which specify cutoff points for what constitutes a positive result based on the person's risk factors. For example, a smaller induration might be considered positive in someone with a high risk of tuberculosis, while a larger one might be needed for others. Using induration as the standard measurement also helps prevent false positives. Redness can be caused by skin sensitivity, irritation, or superficial inflammation that does not reflect true immune sensitization. By focusing on the induration, clinicians can better distinguish between a genuine immune response and other nonspecific skin reactions. While some research has looked into erythema as an additional marker, the consensus remains that measuring induration is the most reliable way to interpret the TST. It provides a clear, reproducible, and scientifically validated method to assess whether someone has been infected with tuberculosis bacteria. In practice, after injecting the purified protein derivative into the skin, healthcare providers look for a firm swelling rather than just redness. They measure the diameter of this swelling in millimeters and compare it to guidelines to decide if the test is positive. Erythema might be noted but is not used for diagnosis because it does not accurately reflect immune sensitization. Ultimately, focusing on induration ensures that the Tuberculin skin test remains a precise and trustworthy tool for detecting tuberculosis infection. If you ever need a TST, remember that the measurement of the firm swelling is what truly matters in understanding your immune response. Always consult healthcare professionals for proper interpretation and follow-up testing if needed.